Today we're going to talk about something that many of us encounter when spending time outdoors: poison ivy and poison oak. These pesky plants can cause quite the itchy situation. So let's dive in and learn how to identify, prevent, and treat it.
It's Doctora Victoria and George.
First things first, let's talk about how to recognize these plants. Poison ivy and poison oak are sneaky because they often blend right into the scenery. A good rule to remember is leaves of three, let them be. This means that if you see a plant with three leaflets, it's best to avoid it. Poison ivy usually grows as a vine or a shrub, while poison oak tends to look more like a bush. Both can change appearance with the seasons, so keep an eye out for the telltale three-leaf pattern. Now, what happens if you accidentally brush up against one of these plants? Both poison ivy and poison oak contain a substance called urushiol. This oily resin is what causes the itchy, blistery rash that shows up 12 to 48 hours after contact. The rash can appear as itchy bumps or blisters, and often in a linear pattern, or even lines where the plant had brushed up against your skin. Having a line of blisters is a pretty classic presentation. One important thing to know is that the rash itself is not contagious. You cannot spread it by scratching. However, if that urushiol is still on your skin or clothes or even your pet's fur, touching those areas can definitely spread the oil and cause more rashes. Prevention is the best medicine, right? So here's a few tips to keep you safe from these plants. You want to wear long sleeves, pants, and gloves to help create a barrier between your skin and the plant. If you think that you've come in contact with poison ivy or oak, wash the area with soap and water right away. Urushiol can stick to your skin, but if you wash it off quickly, you might be able to avoid a rash. You want to be mindful of your gear and your pets because it can cling to clothing, shoes, tools, and even your pet's fur. So clean those thoroughly to avoid accidental exposure later. So say you've gotten a rash. What do you do now? There are some simple treatments that you can try at home. So cool, wet compresses can help soothe your skin and reduce itching. Oatmeal baths can help calm irritated skin and give you some relief. Calamine lotion or hydrocortisone cream, they're over-the-counter products and they can help with the itching and inflammation. You want to remember to use hydrocortisone cream for not more than 10 days on the same patch of skin to avoid thinning your skin in that area. And if someone has a darker skin pigment, know that it can bleach the skin some if you're continuing to use it on the same bit of skin. And you want to avoid scratching. I know it is tempting, but scratching can lead to infection. So if the itching is keeping you up at night, an oral antihistamine like Benadryl might help. It does not directly treat the itch. It's a different mechanism, so it doesn't help with the itch quite as much, but it might give you a bit of relief, especially at night. For more severe cases, especially if the rash is on your face or genitals, or if it's widespread and it's everywhere, you might need to see your doctor. They can prescribe a stronger steroid cream or even oral steroids to help calm things down. Are you still in doubt if you need a doctor? There are times when you should seek medical help. So call your doctor if the rash covers a large area or affects your face or genitals. If you notice pus, yellow scabs, or other signs of infection, the itching or pain is severe and not improving with over-the-counter treatments, you have difficulty breathing or swallowing, that could indicate a more serious reaction. So thank you for joining us today, our healthcare team. I hope you learned something new and feel more prepared to handle these plants. The next time we're outdoors. Remember, prevention is key, but if you do get a rash, there are plenty of treatments to help you feel better fast. We hope that you'll join us next time. Bye-bye.